Akshaya? Akshaya?
I'm here, sir. Shall we start?
Yes, time is.
Happy evening to all our participants and our dear core team members and our resource person for the day. I'm really glad to see all of you in this great gathering on our 250th session. So myself, Akshay Lakshmi, I will be doing the MC for the day. So now I request Dr. Subhashri, Professor, Department of Counseling Psychology, MSSW, Chennai, and our core team member to give the welcome address.
Ma'am, 1 minute. I think the resource person not yet joined. She's having some technical issue. 1 minute.
Sir, I'm joined, sir.
Okay, ma'am. I couldn't find it. Yes, ma'am.
Welcome, ma'am.
Okay. Subhashri, ma'am. Over to you.
Go ahead.
Yes.
Subhashri, ma'am.
Audible?
Yes.
Hello. Suresh, am I audible?
Yes, ma'am. You can audible. You can continue.
Yes, ma'am, you're audible.
Good evening, one and all present here. It's indeed a pleasure to welcome you all for this 250th webinar, the Mental Health Webinar Series 2020. We have been doing this from April 14th onwards. We're happy to welcome Professor Dr. C. Sophia for this wonderful evening, and we are eagerly waiting to know from her expertise and willing to learn from her talk. We are welcoming from the Department of Psychology, American College, Madurai, and other associates, and in collaboration with Madras School of Social Work and Red Pond Academy and International Center for Clinical Psycho-Oncology, Germany, and very importantly, all our community members who have been working right from the April 14th, and our participants who have been traveling right from April 14th. Thank you so much for joining us today. And I welcome you, ma'am, for this wonderful evening for your presentation. And we are really looking forward to learn from your special address on the topic, the adaptive model, Roy's adaptive adoption model. Thank you so much. Over to you.
Ma'am, I think Veena, Dr. Veena, introduce the special speaker. Check your WhatsApp. Over to you, Dr. Veena.
Thank you so much, sir. I welcome you all for our 200 and... Sir, am I audible?
Yes, please.
One second, sir.
Dr. Veena, are you there?
Yes, sir. 1 second, sir.
Okay.
Good evening, participants. It takes me immense pleasure to welcome Professor John Saker, Sir, Dean Policy, the American College, Madurai. I request him to please give special address for our webinar series. I'm sorry for the technical issue here. And sir, I wholeheartedly welcome you for our webinar series, sir. John Saker, sir, the floor is yours.
Thank you, Mohammed. Respected Principal Secretary of the American College, Dr. M. Dominic Christopher, learned resource person of the 250th webinar series on mental health, Dr. C. Jyoti Sophia, Principal and Research Coordinator of CSI Nursing College, Madurai. Participants, faculty members, and students of the Postgraduate Department of Psychology of American College, a pleasant evening to all of you. At the outset, I would like to thank my principal for giving me this opportunity. Dr. Suresh called me this morning, and then he asked me to say a few words about today's webinar. However, I was wondering, since principal asked me to do so, I said yes. And later thought, I was wondering if I am a competent person to say a few words about the series of the webinars that have culminated in 250th one. But still, I invented kind of self-justification. Of course, kudos to the heads of the department. I think principal himself is heading the department, and Dr. Suresh Kumar, which is now upgraded as a postgraduate department, and it is offering MSc Psychology, Applied Psychology from this academic year. Still, I think that my acceptance for offering a few words is that I would like to, in fact, share some of my thoughts on mental well-being. Since I am teaching psychological approaches and psychoanalytic theories to the interpretation of literary texts, where we encounter hundreds of fictional characters. You are dealing with real life characters. We are dealing with the fictional characters like a Hamlet or Macbeth or Iago or Brutus or Romeo or Juliet. All these characters are found in real life also. But friends, in India, somehow we have a negative perception about mental health. We do not treat mental health as seriously as physical well-being. For example, we are pleased to share with everyone in our neighborhood if somebody is admitted to ICU. My daughter is in ICU. Please pray for me. My dad is in ICU. Please pray for. But then when somebody is admitted to a psychiatric hospital, we keep quiet because we think that it's very bad news too. And parents also often prefer to take their children or members of the family to the psychiatric counselor only under the cover of a darkness. They do go only in the evening. Mental well-being, friends, is feeling good about ourselves first. We should be able to function individually and in a relationship in society. But it does not mean being happy all the time. That is not possible. But mental health, mental well-being is being able to cope with the challenges that we face in life, not avoid the challenges, to make use of the opportunities and to feel a sense of purpose. It's quite normal for all of us to feel stressed and sometimes negative, but usually these feelings are somehow managed and we pass on. However, sometimes these negative feelings can develop into a very serious mental health problems. Those who experience low mental well-being over a long period of time, especially from childhood days, are more likely to develop some kind of mental health issues in the future. If you ask me why do people struggle with the mental well-being, some of the reasons that from my experience understand loss of someone who is very dear and near in our family, or maybe loneliness, or maybe relationship problems, or maybe work or study or money issues. These are some of the reasons that challenge our mental well-being. And early life events and traumas also have sometimes effect on our future mental health problems. And there are a number of causes, which are responsible for a kind of imbalance in our mental health. But I'm not competent in authority to talk about it. I'm really happy that the Department of Psychology, which has been upgraded into postgraduate department, I keep telling principal that before his retirement, this department should become a research department also. It's quite a fitting that today's research person, she is not only the principal of a technical institution like a nursing college, she is also a research coordinator. It has become a fashion these days to talk about some medical college, then we say that research institute. In fact, no research is taking place, all commercial ventures. So here we have a resource person now who is also a research coordinator of nursing education in the city, maybe the only college where you have a research coordinator for a nursing program. She's an able educational administrator with rich resources, both India and abroad. She's got a lot of experience, resources, expertise. I'm sure her exposition on the given title, which sounds very technical to me, will be a fitting one on the occasion of 250th webinar, which definitely deserves to be documented for international attention. I think that Dr. Suresh Kumar can take it in the right spirit. I can see that it is entered in a Guinness book, because 250 webinars in a series on a particular topic is something very challenging. That you have done it. Kudos to the entire department. And I don't want to stand between the resource person and you. And therefore, I thank all of you for having given me the opportunity. I wish you all the best. Have a nice, pleasant evening. Thank you very much.
Thank you, Professor John Sekhar, sir. That was wonderful special address. We have heard a very crisp one, and you have made sure that the mental health seriousness of the mental health is spoken. Thank you so much, sir.
Thank you.
Now I request Dr. Suresh Kumar, sir, Head Department of Psychology, American College, to speak about the objectives of the webinar series.
Thank you, Akshay, for giving the opportunity. I record my sincere thanks to our Principal Dr. Dominic Krishna sir, and today's speaker, special address speaker, Dr. John Sekhar sir, who is the Dean Policy of American College, and today's speaker, Ma'am Gobi Sophia, she is a Principal and Research Coordinator of Jayaraj Annapatnam College of Nursing. And we had an earlier with two more programs for Madam, and I think you all understand the importance of our presentation. I'm here to share the objectives of the webinar series we have initiated. I think we all know that WHO given that statement, and the second pandemic will be on mental health component. So we need to be addressed. So we a group of team members, we call them 4 team members. We form from the different parts of Tamil Nadu, and we assemble here to promote the mental health among the people, among the participants. That is our initiative. And we started, rightly said by Dr. Subhasri, we started this initiative in the month of April 14th. And still we are continuing, as Dean sir said, we try to make a record in that different forum. We will try to record it, sir. Our main objective is to promote the mental health, the different perspective. And today with us, Professor Dr. Sophia ma'am, she is a principal come research coordinator of CSI Jayaraj Annapatnam. And when you go through that profile, I can say she's having vast experience in research. And she's a very good presenter related to mental health. And for counseling, she's the one, she's taking care of that college. Ma'am, we are very proud to have as a resource person for today's session. I wholeheartedly welcome you, ma'am. The floor is yours, and we are eagerly waiting for you to listen from you. Over to you, ma'am. Thank you.
Hello, good evening, everyone. Thank you for all your good words. And today, in this situation, it's very apt to speak about the present scenario, that is, it is related to the corona situation, isn't it? So all of us are much worried about what is happening around us. So now here you could see at present World Health Organization, according to World Health Organization, as on 19th October, these many cases. So in India, there are around 75 lakh cases and nearly 1,15,000 deaths have occurred. And Karnataka, Maharashtra, Andhra Pradesh, and all these places. And if you look into the global view of corona, the update is in Southeast Asia, around 54 lakh confirmed cases and around 1,35,000 total deaths. And in world level, the confirmed cases are around 4 crores and nearly 11 lakh deaths. So this is the present scenario, and we're all worried about this scenario. And at this juncture, I thought it's very apt to speak about this ROI adaptation model. It has been structured by Sister Callistra Roy. So it is one of the adaptive system model. Actually, adaptation is responding positively to the environmental changes. So of course, all of us, we know that we are facing some environmental changes, isn't it? Till March 24th, we were all so happy walking around, going for movies, going for swimming pools, going for gym. We were enjoying our life like anything without any restrictions till March 24th. And that came a day on which we have been restricted not to move out, not to go out. You have to shut the doors, be inside, no schools. nothing. And you have got an environment which is totally different from probably if you are 50 years old. All throughout this 50 years, you haven't never had a situation like that, but yet the situation has come that you have been restricted. Your environment is totally changed. So what is our response? What is our adaptation towards the system of environmental change? Okay, so every individual is a matter. For example, whether the person is going to be an engineer or a doctor or an administrator or an educator or just a student, if they become sick, they are called to be patients or clients. They are put into the hospital. They're supposed to obey the rules and regulations the doctor or a nurse is telling you, isn't it? That is the situation of any human being who becomes sick, especially in this time of corona. Probably not only the patients, but also the doctors, nurses are also much worried because they haven't got proper idea of what to do, how to go about, whether doing this will risk their life, doing that will risk their life. So instead of not only taking care of patients, but also they have to handle their own risk. So this is why adaptation model will be more apt to speak at this time. So now if you could see this model, there is a stimuli every human being undergoes. Accordingly, their behavior changes. So a person who is, whether they are the normal person, normal human being, or who is a patient who is sick enough to get admitted into the hospital, so according to their physiological, psychological level, they respond to their environment. So as a patient, how do we respond? So if you are looking to the nursing profession, nursing is a scientific discipline. The nursing models provide the basis for selecting knowledge to be transmitted in the nursing education. It is the framework for nursing practice and the direction for nursing research. So let me just look into this Roy's adaptation model. It was done by Sister Callistra Roy. She was born on 14th October 1939. She did her both BSc and Masters in Los Angeles, and she was doing her Masters in Sociology also. And she has just developed this particular model of taking care of a patient or making some sense in taking care of the patients in their stressful situation. So let us see. Now then, nursing is to help a person to adapt to the physiological needs, self-concepts, and function and interdependent relations during health and illness. So as a patient is getting admitted into the hospital, they are sick, and there is a continuum of from illness to health or health to illness. So there are two continuums in which the patient has to adopt to the situation. So probably to adopt into the situation, there are some assumptions you need to think about. So suppose if you take up the scientific assumptions of taking care of patients. So the scientific assumption has got few roles, that is the matter and energy. Every human being has got some matter and energy. They have got their self and environmental awareness. They have their thinking and feeling abilities, their system of relationships, their interpersonal relationship, their environmental transformations, integration of human environment. So these are all the scientific assumptions. If you look into the philosophical assumptions, there are mutual relationships, human meaning. God is the intimately revealed in the diversity of creations. Persons use the human creative abilities, and persons are accountable for sustaining and transforming the universe. So these are all the philosophical assumptions every human being is handling with. And assumptions from humanism is that the creativity, the purposefulness, the holism, and the interpersonal process. An assumption based on the vertivity is purposefulness of human existence, unity of purposes of humankind, activity and creativity for common goods, values, and meaning of life. So now just think of, let me go back to that slide. Now look into the situation of Corona. Every human being, as an individual, one or other time we get sick, we get into the hospital. What happens? The doctor is giving you the treatment. The nurses are helping you to carry on the treatment. The doctor just prescribes something, go away. The nurses are all the time with the patient, try to understand the problems of the patient. For example, some patients will have physiological problems, like they might have pain, headache, vomiting sensation, or sleeplessness, restlessness, positive emotions, negative emotions. So both physiological and psychological, even social well-being, they might face problems. So the nurses are the ones all the time with the patient, taking care of the patient, say probably 8 hours or even 10 hours or 12 hours, the nurses are there taking care of the patient. So now then the nurses are helping the individual client to come across the sickness condition. And we are trying to help them to come to the normalcy. So we make them to adapt to the situation so that they can respond positively to their environment. So that is the role of the nurses. But now then, look into this Corona situation. So now the patients are there. They are much terrified whether I will get all right, whether I could meet my family or not, or whether I'll die here itself. My family members will meet me or not. So those queries the patients will be having. But at the same time, think of the nurses. The nurses also will have the same fear, whether I will get caught up with the infection, whether I could be able to meet my family or not. Of course, all of us might know a lot of WhatsApp stories were coming up and informations were coming up that nurses got infected and they are supposed to be away from the family for 14 days. They cannot go back home. They have to stay in a hotel or in a hostel to take care of the patients for 10 days. And after that, 1 week of quarantine for the nurses. After that, only they can go home. So think of the stressful condition. Think of their very painful and stressful condition that they cannot even think about their own health and their family and other things. Here, let me just give you an example of my own family. One of my family member, one of my relative, she was working in Kuwait as nurse. Her family is all the way back at Tamil Nadu. So day 1 onward, she was posted in ICU, intensive care unit, to take care of the Corona patients. So now then she was telling me that even I didn't have time to eat. I didn't have time to sleep. I was taking care of the patient. Almost all, probably in one day, we need to pack up 3 or 4 dead bodies. So this was the statement she has given. Think about her mental status. Actually, in the continuum of taking care of a patient, if a patient dies off, then we need to give all sorts of care, the religious mode of care, and proper grieving process should be done for the relatives when the patient is dying or dead. So those things should be taken care. But whereas in the Corona situation, they were telling at a time in a day, probably 5 patients dying, 6 patients or 10 patients. So we need to just go and pack up. There was no one to even cry for the dead body. So think about the stress of the nurse. And she was telling that in her duty time, she has seen almost, she was packing up nearly 50 or 60 dead bodies in a row, in a month. She was about to do all those things. So think about the stress that nurses would have gone through. So if you look into these pictures, you can very well just assume how the situation was going on. So at this juncture, the major concepts of this Roy's adaptation model were adaptation is the goal of nursing. So the nurse she herself should know how to adapt herself. as well as she must help the patient to adapt to the situation. And the person, the client is the adaptive system, the environment is the stimuli, and the health is the outcome of the adaptation. Positive health is the outcome of the adaptation, and the nursing is promoting the adaptation and health. So adaptation, as I told you, it is like responding the positive, positivity to an environmental change. The process and outcome of individuals and groups who use conscious awareness, self-reflection, and choice to create human and environmental integration. So here, of course, who is a person? So the person, both the nurse is a person as well as the patient is a person, biopsychosocial being in constant interaction with the changing environment, uses innate and acquired mechanisms to adapt. An adaptive system, described as a whole comprised of parts, functions as unity for some purpose, includes people as individuals or in groups, families, organizations, communities, and society as a whole. So when a nurse taking care of a patient, here the person is the client, the patient is a person, the relatives are the persons, the co-workers are the persons. Okay. And if you look into the environment, what are the environments? The internal environment and the external environment. Internal environment is nothing but the ability of the patient to cope up, their immune system, their electrolyte imbalance or balances, their temperature level. Those are the internal environment. Their external environment is their surrounding. And the contextual is all stimuli present in the situation that contribute to the effect of the focal stimulus. And the residual is the factor whose effects in the current situation unclear. For example, if a nurse need to take care of a patient, they have to have a positive environment to take care of a patient. For example, in case of corona, if the nurses are facing problem with inadequate protective equipments, and if they are unable to manage the critical situations with the improper or lack of proper equipments, so those things can lead on to the negative effect. So for a nurse, the positive environment is there should be a calm and quiet environment, cooperative relatives, cooperative environment, doctors should cooperate, and appropriate equipments must be there. So these are the positive environment. So if you have a positive environment, the health process is very quicker, like easily the patient gets well soon. So the health is the inevitable dimension of person's life, represented by health, illness, continuum. So all of us, of course, one or other time we get sick and we become all right. So it's a sort of health and illness continuum, and a state and process of being and becoming integrated and whole. So a nurse is the one who's taking care of the patients in adaptive modes in health, quality of life, dying with the dignity by assessing the behaviors and factors. So when the patient even dying, at that time the nurse is supposed to give some respect. With all dignity, they need to handle the situation. That's very important. So at this Roy's adaptation system, we have got some subsystems, that is the cognator subsystem and the regulator subsystem. So the major cognator subsystems are the perceptual and information processing, learning, judgment, and emotion. For example, if a patient has got a newly detected diabetes, probably the nurse could teach them to take regular medications or insulin injection. So the nurse could teach them how to take up tablets or what time interval they can go on with their insulin injection, or sometimes they can go on with their checking of their sugar level by using the glucometer. Those things should be taught to the patients. And the patient sometimes might have the emotionality. Sometimes the patient will take it in a positive sense or negative sense. Sometimes patient will be irritable. And in other way around, sometimes the nurses might be very irritable and the patient cannot just cope up with. So these are the cognitive subsystem in the continuum of health and illness in a patient. And regulator subsystem is the it is through neural, chemical, endocrine coping channel that is inside a patient. So that is the internal environment. So the 4 adaptive modes are the physiologic modes, self-concept mode, role function mode, and interdependence mode. As I told you, physiological need, of course, all of us, what are the problems the patient is getting admitted with? The problem should be get all right. For example, if the patient get admitted with fever, fever should be subsided. And if the patient has got a headache, vomiting, diarrhea, nausea, whatever the symptoms might be, if you deal with the physiological problem, then it is physiological needs. Self-concept is probably, as I told you, it is the value, human attitude, human nature. So how do you approach a patient with respect and dignity for human values? That is self-concept. Role function is, as I told you, whether the person is an engineer, doctor, or even a policeman, their role function in a hospital setup is just a patient. So now they have to obey whatever the nurses are telling you to carry on. And interdependence is that the nurse, doctor, paramedics, and other cleaning workers and patient relatives, they have got some interdependence. So all these should work together well so that there will be a fast recovery in a patient's health and illness continuum. So that is very important. So this is the overall Roy's adaptation model. If you could see that it starts from the management of stimuli. So management stimuli is the environment. As I told you, stimuli is the environment, the internal environment or the external environment. And from the, it could be a focal, contextual or residual stimuli. If the environment is carried on properly, taken care properly, the coping process will be good. So the patient could cope up well. It is between the regulator, cognator, and innovator level. And then the adaptive modes. The patient could have a positive adaptive mode so that their recovery will be very good. So that integrated, compensatory, and compromised recovery could happen. So this is the adaptation model. So actually nursing profession, as John Seger sir rightly pointed out, now you might think that what sort of research we are all carrying on. Every situation, we take it into consideration. We just try and work it out. What best modes or methods could be carried on to handle a patient in a proper situation. Okay. So, for example, mode of delivery. Some people might think that cesarean is good. Some people might think that normal delivery is good. Some people might think that induced delivery is good. Some people might think that to reduce pain during delivery, submersive, that is underwater delivery is good. Whether the husbands can be allowed to be near a patient at the time of delivery. So there are many methods and modes to reduce the pain at the time of delivery. So now then, it is our responsibility. We carry on research activities to find out, say, we take up 30 patients, 10 patients with normal delivery, 10 patients with cesarean, 10 with submersive, underwater delivery. So we carry on research on that. And for example, to heal a diabetic wound or to heal a burn wound, what sort of measures could be taken? So we carry on research based on that. We have got postgraduate research program as well as doctoral research program. So far we have, there are around 25 candidates who have passed through our institution and PhD in research in the field of nursing. So this sort of models, we have got humpty number of models, research theories. Based on these theories, our nursing process works on. So the scientific knowledge for practice, that is clinical assessment and intervention. That is when you carry on any practice, say for example, if you look into a patient, you see the patient in a scientific approach. Look into the person as an individual with the due respect. We handle the patient, but at the same time, we manage to put our scientific knowledge to make the patient all right. You should have heard about the olden days nurses at the government hospitals. So probably around 100, 200 patients standing in a row. So the nurse will be taking a big vial of vitamin B12 injection with a nearly 20 cc syringe. So have one prick, take all 20 cc this thing. So first patient 2 ml, second patient 2 ml, third patient 2 ml. So this sort of old methods have been gone. Now then everything is scientific, everything is research oriented. Now also you would have heard about taking care of a corona patient. People charge nearly 3 lakhs, 4 lakhs, 5 lakhs. It is all for their PPE, the personal protective equipments. As such, there is no proper treatment or no exact medications for corona patient, but just to protect the nurses or the doctors or the other co-workers, we use personal protective equipments, isn't it? That is more costlier than the treatment which is given to the patients. So the clinical assessment and intervention is very much essential, and research variables. We carry on a lot of research activities. So Sister Callistra Roy has spoken in her way back 1971 itself. She has given this beautiful model of how well it could work on, this Roy's adaptation model could work on to carry on appropriate nursing care for the patients. So to guide nursing practice, to organize nursing education, and to even frame the curriculum based upon this sort of adaptation models. So if you look into this particular theory, Roy's adaptation theory, the theory is interrelated because this theory correlates with a lot of other theories, which is the contemporaries of Sister Roy has done so many other theories related to this. We could say that even Florence Nightingale has, at her period of time, infection control measure, she was much interested in infection control measure because in Crimean War, many people were dying of infection only. So she was much concentrating on hygiene, personal hygiene, environmental hygiene, other things. So Sister Florence Nightingale theory was based on infection control measures. So after, coming across different stages, now then this theory, this theory of Sister Callistra Roy's adaptation model, it is about having a positive note towards the environment. So environment is the surrounding, God, the relatives, the community, the caretakers, the doctors, nurses. So only when the patient is having a very good support system, they could easily come across their health and illness continuum. Even in this corona situation, I could say that God has given me an opportunity to give counseling for nearly 30, 40 patients. I was counseling at the time when they were inside the hospital. So almost all were very educated persons, but even then they had fear of death. They thought once the corona comes, we all will die. So this was the phobia all of them were having. So God gave me a chance to speak with the people. I was counseling nearly 30, 40 patients, all learned people, highly educated, highly placed, very good VIP patients. But when I was speaking to them, they were like small kids. They were crying and they were worried a lot. And I told them, Uncle, Auntie, there is nothing to worry. You need to take care of yourself. Eat well. Food is the only medicine. Keep yourself always alert, happy. Think that you will come back home soon. You'll be all right. You'll be meeting all of us. So this comforting words of counseling just helped them to come out of the situation fastly. And now then these 30, 40 patients, they were counseling the other friends, fellow beings, relatives who got admitted. So even the elderly age, they were able to come up. It's all because of the very good support system and the adaptive system. So that is very, very essential. So when you come into the overview of Sister Callistra Roy's theory or model, it is interrelated, it is logical in nature, and it is simple. It's generalizable. It's simple and it could be, there is no borders, limits. This theory is useful only for Indian nurses or only for American nurses. No, nothing like that. Though she is being an American, we are also using in India, also in Tamil Nadu, in remote villages also we are using the same theory. So it is generalizable, can be the basis for the hypothesis that can be tested. So if you come across such variety of patients, the hypothesis could be tested in research field. It contribute to and assist in increasing the general body of knowledge and discipline. Can be utilized by the practitioners to guide and improve their practice. And it is testable, consistent with validated theories, laws, and principles. It has been earlier tested with nearly 190 patients. She was testing, then only she released this particular theory. So Roy's adaptation model, it is a logically, easily understandable and adaptable theory. So theory itself is a very understandable and adaptive theory. And there is a moral, ethical, and spiritual, psychic, and social response. All modes have been collected into this Roy's adaptation model. So this model is one of the very effective model where this could be useful. Probably this has been done so earlier, but yet even at this corona situation, we could use this adaptation model to take care of patients in any situation. It could be a government hospital, a private hospital, in a very luxurious hospital, or in a low care area. The total system is only this. That is, a person should be taken care wholly with all adaptive system in their environment, with the balancing of relatives, their environment, with the medical care, the patient can get well soon. And but only thing, the nurses also, they have to take care of themselves to come across the stressful situation so that they can easily revive out of their problems. So that is about the Roy's. Let me show you that picture. So this is the Roy's adaptation model, diagram of human adaptive system. Here you could see that there is a stimuli, and the stimuli is this physiologic, self-concept, interdependence, role function, and that leads on to the coping process. The patient is able to cope up very well, and that reflects as their behavior. So the patient is probably day one, the patient comes in with sickness. They might be very upset. They might be very stressful. They might think that I might even die. But coming into the system, probably with all physiological and self-concept level, with a good coping process, their behavior might change. They feel happy, they become all right. From sickness, they go into the continuum of wellness, and they become all right, get discharged. So this is a Roy adaptation model or theory of Sister Callister Roy. So I'm very happy to present this particular model with you. Future, if possible, I can come and join with you with a lot of other models and theories related to the field of nursing. So thank you once for giving me this opportunity. Thank you so much.
Thank you so much, Jyoti ma'am. That was indeed excellent presentation. And a nurse is one who opens the eyes of a newborn and gently closes the eyes of a dying man. It is indeed a high blessing that you are the first and the last to witness the beginning and end of life. And also, when you are a nurse, you know that every day you will touch a life, or a life will touch yours. You don't build your house without foundation. Likewise, you don't build a hospital without nurses. Thank you so much for enlightening us with your presentation. And your presentation has really initiated that we can all together work towards a new research where we can have an integrative sort of research programs with all the mental health professionals coming together and doing new researches. Thank you so much, ma'am. And participants, whoever have any questions, kindly put in the chat box, or you could unmute yourself and go ahead with your questions.
Rena, there are a few questions in the chat box. Can you read it?
Yes, sir. Sir, can you please do that, because my chat box is stuck here. So you have to unmute yourself.
Okay. I think that question is related to question one. Dear participant, if you have any questions, you can contact. You can come up and you can ask. I have, as you said, there are many models are there. We have to face in this crisis time. Other than this model, any other model is there? We can explore ourselves to understand the concept. Other than RISE, can you give one light on that? Ma'am, audio is unmuted. Yes. Now it is open.
So there are some environmental models. I told you the Florence Nightingale model is there, and there are some infection control models, and mostly those models are related to medical system. And there are some psychological models. And probably you should have got some theories related to psychology, isn't it? Psychological theories. We used to use those theories also into our nursing system. So psychological theories also we will be using in our thing. Or otherwise, there are around 6 theories in nursing. That is Sister Callistra open system models, and communication models, and infection control models, and system adoption models. So these are the models.
Thank you, ma'am. And when your presentation, you said that the RISE model still it is an applicable to Indian Tamil Nadu also. That is an interesting thing. And some of the models in psychology we can say which is applicable to only particular culture. When we try to implement in our culture, maybe it may not be suitable. But as you said, it is suitable for Indian culture also. Thank you so much, ma'am. And some of them they are asking your PPTs. Can I share the participant?
Yeah, you can. You can say no problem.
Okay, thank sir. Ma'am, there is a question from Shubhashri, ma'am. Ma'am, what's your suggestion for nurse self-care? Because they are more prone for stress day in and day out. So, what are the few tips you would suggest for this self-care?
Exactly. Actually, we have got a Tamil Nadu Nurses Registration Council. So the council responsible for all the nurses, in and out Tamil Nadu, the Tamil Nadu Registration Council is responsible for all the nurses, because every 5 years once we need to get register with our this registration council. So the registration council has taken effort to conduct webinar sessions and Zoom meetings to face all our nurses. Sometimes even the nurses who were in quarantine. Probably 1 week they need to work and 1 week they will be quarantining. Say in Madurai Medical College Hospital, Government Rajaji Hospital, Sarada Hotel, the nurses would stay. They will take care of the patients. And after that, they'll go put up in Hotel Heritance for their quarantine. So they cannot go home at all. So in the evenings, we used to conduct Zoom meetings and webinars for our nurses, those who were in quarantine. And in WhatsApp groups also, we were just comforting them. There were a lot of prayer groups who were praying for the special nurses who got infected. And we must really thank our Dr. Sangumani, who's the Dean of Madurai Medical College. He has kept a very special ward for nurses, those who got infected with the COVID. So in the beginning 2 sessions, people were so stressful, they were not able to bear the condition at all because they thought, oh, let me not get the chance of working at COVID, Corona ward. Like that, they were worried much. But nowadays, it gets acquainted. Everybody started loving to work even at Corona ward with proper protective measures. So now then they have come out of their fearful situation. But as I told you, some of the nurses in abroad, they were worried a lot, looking into the very drastic death rate and other things. And some people have got even infected also, but yet they were able to overcome. And every nurse, first of all, if they are very, confident enough in their skill, there are barrier technique and reverse barrier technique. Barrier technique is that we should protect ourselves from getting, we should be very careful not to spread the infection. And the reverse barrier technique is we are not supposed to get infected from the patient. So both the way, we used to teach the nurses in the year 1 itself. First year itself, they would have learned about how to protect themselves from getting infection. Using mask, cap, and other glove, hand washing techniques, and apron, all those things we used to teach them in the first year itself. So everyone is well aware. I could say that even very freshers, just pass out interns, they have got placement in railway hospital and in some of the airports to take care of the COVID patients. They were very happily going on. There is no need for them to give a special training for the nurses because the day 1 they enter into nursing profession, we teach them how to protect themselves, both mentally, psychologically, in all other ways. But COVID is a very special situation. The patients are the nurses are so much stressed out because they don't know from where the infection comes in. Might be from the patient or even when they go out. So there are a lot of stressful situations. But now then they all have coped up well, very well. And by means of meetings, webinars, and repeated informations given to the nurses with all proper PPE, they are all happy, they are protected.
Ma'am, thank you for answering that question, ma'am. Another question is, ma'am, is this ROI adaptation model only pertaining to the research, or is it like an educative program for the nurses?
There was one point you've seen that it is for the curriculum in nursing. The year 1 for BSc nurses, general nurses, also we teach them. So to prepare the curriculum, it is useful, not only for research, even for the basic level, we are using these sort of model, not only Roy's model, but also all other models we are using for teaching. Even to prepare the curriculum of nursing, we use it.
Okay, ma'am. Thank you. Next question is, there is a lot of difference between the approach of nurses in Indian context and in Western countries, I mean in abroad. So how could we improve it here? Even Indian nurses abroad who are, like Krishnan sir, can you please ask the question?
Yeah. See, I found the nurses. Am I audible?
Yes, sir. Yeah, please go ahead.
Yeah. See, the approach to the patients, I found they are compassionate. I mean, definitely here also they will be compassionate, but the way they speak, maybe they in India, Veena. So, and abroad, they are, they are very kind in words. Their approach was totally different. But whereas here it is, you go here, don't stand here, like that. There's a huge difference. So how one can improve that?
Yeah,
Patients are coming with they're looking for some solution for their illness, and this is added woe here.
exactly. It's a very Why it is echoing?
Well, you can go ahead with your answer now. Yes.
Okay, very apt question, sir. The thing is, actually, it is because of nurse-patient ratio. In foreign countries, they easily manage with exact number of nurse-patient ratio. For example, in ICU, there is only 1:1. That is one nurse, one patient. If you come to the general wards, 10:1. One nurse for 10 patients. If you go to critical, OP cases, 5:1. So foreign countries, they follow this system. Exactly every hospital, if they get, if they need to have their recognition, then probably they need to cope up and they need to fulfill this requirements. Whereas in our Indian setup, it is not possible. Almost all the nurses, they fly abroad. Only few nurses are here. For, as I told you, as one of the example, for 200 patients, there is one nurse. Whereas in abroad, for 5 patients, one nurse. So this is the, scenario here. But nowadays, even in private hospitals, in Madurai, if you go to a few of the private hospitals, you could see very well that the nurses are polite. If they are not polite, probably the management will mix them up.
Ma'am, actually, I personally go to government hospital because I feel the doctors are much experienced. By seeing the patient, they are able to diagnose very well. For example, when I diagnosed with my eye issue, by seeing my eye, they said, go and check your pressure, which was okay. So in that context, I always trust government hospital, even despite being, they talk about, stealing of organs and all. But despite the fact, I trust and I go to government hospital because of that. Because I trust doctors. So that's why I go there. But, if these kind of things are happening, it is very difficult. So that is why that was the reason for which I asked this question.
Okay.
Because I see Filipinos, Malayalis, and these people whom I have interacted with, they were really kind and they were taking good care of the patient. So that is why that when we are here, when we are there, that's why we are changing. So that is the thing I just wanted to. Thank you, ma'am.
Thank you, sir.
Doctor, can I ask one question?
Yes, sir. Sharikar, sir, please go ahead.
Yes, ma'am. Actually, you are telling the statistics and the less manpower of the nurses in India. Are they given any skills like training for coping the burnout situation, madam, when they are working so much? How they are able to cope up with their own personal burning out issues?
Actually, if the higher official is good, just now I gave you one example, Dr. Sangamani is doing very well. It's because he is managing the situation of his own. He has taken his own interest to talk with the management of Sarada Hotel and Heritage Hotel. He has made all the arrangements to give a very comfortable stay for the nurses. Right? So it depends upon the higher official. If the dean is a very good person, he could just go ahead with all these things. Even for managing the burnouts, they often conduct a lot of continuing nursing education programs. We give them counseling sessions. Even I used to visit, I'm a private nurse, but even then I used to visit the government hospital nurses, talk to them, give them a lot of orientation about how to deal with the patients and other things. It's because the principal of the government hospital, the nursing college, she is my PhD scholar student. She is doing her PhD under me. So now we have got some hold on that. So we are just managing. So to manage the burning out situations, they are taking some efforts. Things will be going on well, but only 2 or 3 years this dean will be there, and after that a new dean will come. He'll be there for only 6 or 7 months. Then again he'll. So they have to think about only their appointments, their relieving order, and how to go about and how to settle their issues and all. They don't mind about the nurses or their burning out issues and other things. So probably it all depends on the higher officials. How do they manage the situation? How do they look into the well-being of the patients and the nurses? So it all depends on, but yet in our side, we try to manage it as far as possible.
Correct.
Thank you, Sharika sir. Thank you, ma'am. And nursings do have psychiatric nursing in their third year in their curriculum, if I am not wrong, because I happen to be an external examiner for correcting those papers, and I've been going through the syllabus they had. So definitely they are taught the coping skills and also a few things regards to the psychiatric issues and how to deal with the patients, and definitely they will be having a little knowledge how to have some coping mechanisms for them. Like ma'am said, ratio of the patients is huge, and definitely more than the physical burnout, emotional burnout is one factor that is found with nursing staff. And moreover, among all the professions, nursing is said to be the noblest profession by WHO itself. We are very glad to have you today, ma'am. And now I request Dr. Salim sir to please do the honors vote of thanks.
Thank you, Veena ma'am. It's my pleasure to give you a vote of thanks today on 250th webinar session. And I would like to thank you today's chief guest and special address by the Professor John Shekhar, Dean Policy at the Department of Policy, the American College, Madurai. Sir, thank you very much to honoring the today's session. It's our pleasure to thank you from our heart. Thank you, sir. And I would like to thank you to the today's resource person speaker, Professor Dr. C. Jyoti Sophia ma'am, Principal and Research Coordinator, Jayaraj Annambakam College of Nursing. It was a very good topic and discussion about the Roy's adaptation model. It was a wonderful session and explanation by you, ma'am. So, and we learned a lot about this adaptation model. I think we understood that this model, it's like a 360-degree model. So any model, it's relating to 360 degree, definitely it will be the, we can say 80 out of 100, more than 80. Because in appraisal performance, we can see there is a flat appraisal system and 360 degree system. So 360 degree is a transparency and it's looking around all the aspects. Like here, ROI model, I can understood it's dealing with, model is dealing with the patients, doctors, and the nurses staffs and environmental equipments. So it's dealing with the 360. Definitely the system will be helpful and rightly you said the usefulness, it's scientific known for practices and as well as for the curriculum framework also, of course. And this is the best benchmark practices, I can say. So probably course of a time across the India, this best practices might be implemented to get the 100 out of 100 in the results. So thank you very much, ma'am, for the wonderful overview about the latest best practices of this adaptation 360-degree model. Thank you very much. I would like to thank you on behalf of the American College, Madurai, MS Chellamuthi Institute of Rehabilitation Center, Madurai, Madras School of Social Work, Chennai, and International Center for Clinical Psychology, Germany, and the Psycho Oncological Association, Turkey, and Red Pond Educational Research Center, Madurai. Thank you very much for the chief guest and special address person, Dr. John sir, and thank you for the resource person speaker. And as well as thank you all the participants today to honor our 250th program. So you are traveling from April 14th to till this. So thank you very much and thank you one and all.
Thank you, Dr. Salim sir, for vote of thanks. And I want to place like nursing is one profession where they become an integral part of our family. That's the reason we address them as sister and brother. So with that, I request Dr. Suresh Kumar sir to say a few words and wind the program.
Thank you, Dr. Veena sir. I place my again official vote of thanks. I record my sincere thanks to our team, Dr. John Shekhar sir and today's speaker, Professor Sophia ma'am, for today's session. And I record sincere thanks to all the participants. Without we cannot reach this milestone. And when we started with the 24 participants and once we reached the 600 participants, now there is a curve is coming down and definitely will reach more participants in coming days. Thank you all. We'll meet with another session tomorrow. Thank you. Thank you. Thank you, ma'am. Thank you, sir.
Thank you. Good night.